the risk of being repetitive, the theme of my show is interviewing interesting, unique people who have a connection to Vermont. So Dr. Corey Orava, he lives in the Manchester, Vermont area, and he works for Enso Discoveries, that's E-N-S-O, Enso Discoveries, which is headquartered in Manhattan, Kansas.
The Little Apple.
And Dr. Orava is a doctor of veterinary medicine, and he is the chief scientific officer of Enso Discoveries, and he's considered an expert in veterinary regenerative medicine, and we're going to find out what that is all about. So, Corey, one of my standard questions, I'd like to clear it up right away. You're involved with a company out in Kansas, and you seem to regularly travel the nation, even the globe. And why Manchester, Vermont, for your residents?
It's a good question. So I was actually in practice. I practiced veterinary medicine first in California. I'm actually from Canada, so I did my vet school and my post-vet school training in Canada. Then I went and practiced in the Bay Area of California for 6 years. And we were just too far from family, so we decided to move back east. And so I interviewed from New Jersey to Maine. And when I got to Vermont, I was like, this is where I want to raise my family. And my wife came out, and it was funny, our realtor, Tom Williams, took us to Friendly's for lunch in Manhattan. And behind my wife at the table was a bunch of high school students. And so after lunch, my wife came up, she's like, do you know what the kids were talking about? I'm like, who's dating who? She's like, no, they were talking about chemistry, and they were excited about it. And then so we realized, and this is where we learned about BBA, and we realized that Manchester's a really unique town. And now we've been here 17 and a half years.
Well, I guess it's good, the attraction, the magnet that Manchester offered. So
it's been fantastic. My wife and I both work virtually, so we can live anywhere we want. And it's funny, when we tell people we live from Vermont, I usually get one of two responses: why, or you're so lucky. The former, I've never been here.
So I guess in reviewing the website for Enso Discoveries, I began to appreciate the breadth and scope of animals, whether they are agricultural animals or domesticated animals like household pets. I mean, there's such a far-reaching economics and history and business represented here.
Oh, absolutely. And now there's a move to what's called One Health, which is rather than just say veterinary medicine, human medicine, it's where's the overlap? They're not mutually exclusive. Like our company, we actually make devices that we sell to veterinarians and to physicians. And so we train both, and there's a lot of overlap between them.
I never thought that would have been the case. How was that always the case? I mean, historically,
Well,
I always felt that veterinary medicine was relatively primitive and basic.
So veterinary medicine, basically, it's kind of like the stepchild to human medicine, for sure. And we tend to get a lot of our drugs and procedures from human medicine. But there's been a change, I would say, probably in the last 15, 20 years, where they're recognizing that, first of all, there's a lot of clinical trials you can't do in people. So you can do them in cats, dogs, cows, horses, or whatever. So all of a sudden now we have animals, so we can take that data, extrapolate to humans, but that data we can also use in vet med to improve the lives of animals.
Now, just to pause here a minute, you say you were practicing veterinary medicine for, I think, 7 years or so.
About 7.
And in Vermont here, I guess the veterinarians, the big market is agricultural animals, right?
It depends where you're located. Northern Vermont, where there's a lot of flat real estate, there's a lot more agriculture as far as, because agriculture with animals tends to be large animals, mostly cows. Cows are big, you need a lot of space. And when you're down here in the mountains, there's just not a lot of space for them. And what space there is tends to be a little too expensive for farming. So in this part of the country, or this part of the state, I would say it's more common companion animal, cats, dogs. Almost every household has a cat or dog. There's also a fairly good horse population. As you get further north, now you get near Lake Champlain, that's where you're going to get a lot more dairies and even some beef. And other things more like what we might be considered exotics, like the camelids, your llamas, alpacas.
So just to, again, the investment here, the cost factors. I mean, veterinary care for a horse or a cow or cattle.
Yeah.
I mean, that you're probably running into quite an expense here, right?
Well, yes and no. First of all, kind of like human medicine too, we try to get more into preventative care. It's much cheaper to keep an animal healthy than it is taking a sick animal and making it better. But one of the issues with large animals is, so the average horse weighs 500 kilograms, which is about 1,200 pounds. So I'm a 6'3", 200 pounds. So if I need a drug, if a horse is going to take the same dose of that drug, they need 6 times the dose. So all of a sudden, some drug that might cost $10 a day for me might cost $60 a day for a horse. And same thing with cattle, which are large animals. They become cost prohibitive, some of these medications, because they're just so darn big.
So for the average layperson or consumer, the perception, I don't think people consider that if someone has a herd of cows or a farm has horses, a bunch of horses or whatever, the investment that's involved there, and as you say, to keep those animals healthy, and I guess regular checkups and testing and all, right?
Yeah, so in food animal, people don't realize just how selected for, especially like dairy cows, for example. These animals have been so selected for maximum production of milk that they now run a fine line. They are such efficient converters of food energy into milk that it's kind of like if you're driving your car and you're revving it at the red line all the time, that's putting strain on the engine. It's more likely to go wrong. Whereas if it's somebody who has just an animal for a pet, all of a sudden you're not pushing them so hard. So in food medicine, we really have a struggle of keeping maximum efficiency so that the farmer can be profitable and yet not letting that animal get damaged. The equine side is kind of the same deal. Horses are designed like Ferraris. They are really good at going fast, really good at turning quickly. They're not so good at problems. Let's think of like a horse is a Ferrari, a cow is a tractor. I can take a tractor and go over a curb, no problem. The tractor's not even going to notice it. But I can't go 0 to 60 in 5 seconds. If I took a Ferrari, I can go 0 to 65 seconds, no problem. But if I hit a curb with a Ferrari, I have broken parts of the Ferrari. Horses are kind of like a Ferrari in that they're designed to go fast, but when something goes wrong, it can go really wrong. Cows are much more slow and steady, except when we push their GI system. Because now what we're trying to do is not rather than their orthopedic, their musculoskeletal system, we're trying to push their energy conversion part of their bodies.
And when you get into areas like cattle, categories of cattle, like you see this special meat, the Japanese Wagyu cattle, or Vermont, I believe, has specialty cattle that they promote and foster, and I guess there are special care considerations that go with those upgrades of cattle, right?
Yeah, so we have kind of different breeds of cattle. This is more in beef. So in the beef section, we got like the Channel Island breeds, we got the continental breeds, and we have the more exotics like the Japanese breeds. And they've been selected to have either more muscle or more fat within the muscle, which people refer to as marbling. And so your Herefords, your Angus, those are the kind of the cattle you're most likely to see in North America that are really good at producing a lot of marbling. Wagyu is that just to another level. The amount, like sometimes you'll look at a Wagyu steak and there's more fat than meat.
So the role of the veterinarian in terms of these farms, and perhaps you're functioning as part of the team of the farm, where you are concerned about the economics and the outcome, the production, right?
Yeah, absolutely. So if you're in big commercial farming, whether it's a dairy farm, a sheep farm, a pig farm, chicken farm, the veterinarian is absolutely part of that team. They're not there just to make sick animals better. They're there to maximize efficiency of the farm.
And I guess that with part of that again, it's complex. The veterinarian has to assure for standards, regular standards, right?
Absolutely. Yes, there's state standards, there's federal standards. The other role that would come into food production too is there's also the state veterinarians and there's meat inspectors. So there's a whole gamut from beginning to end as to where veterinarians are involved.
Where the veterinarian is accountable, right?
Absolutely.
So what I'm finding is that veterinary medicine is much more complex than I think many people perceive. And perhaps it's even more complex than the human species of medicine, where there are basically a male and a female. But with animals, there's many different types of species, right?
I remember in vet school, this is many years ago, but we're studying anatomy. And so you learn the vascular supply of the horse. And all of a sudden, they present a dog, and they have a different vascular supply. Now, it's 90% similar, probably 95% similar, but that 5% difference is more than enough to make you want to pull your hair out. And then you go to the cat, and the cat's different. And then you go to the cow, and the cow's different. And you're like, oh, humans must be so easy. And then we go into practice, and when I practice just on horses. And so a lot of it is orthopedics, lameness. So you show up on a horse is lame. So you have to, first of all, the horse can't tell you where they hurt. You have to watch them go and determine which leg is sore. And a lot of times it might not be a leg, it might be a neck pain, it might be back pain, or it might be two legs. So you have to figure it out. Whereas we also, like I said, we sell our kits on the human side. And so when I train physicians, we have volunteers that come in for various maladies that the physicians treat. And so the patient goes, it hurts here.
And if my knee hurts, I could tell you about
exactly.
it. Right?
I'm like, this is so easy. And obviously, I'm oversimplifying. That's just one aspect of medicine.
And also, I mean, Vermont is a relatively small state in case study in terms of the industry and economics. And we didn't even touch on things like alpacas or llamas or sheep, right? So, I mean, veterinary medicine is very crucial in protecting the investments of these animals, right? And the people
absolutely.
who operate
absolutely.
and have them, right?
It's crucial to the business.
So Dr. Orava, what are some of the ways in which you and Enso Discoveries are developing innovations and improvements to veterinary medicine?
So we're in the field of what's called veterinary regenerative medicine, or just regenerative medicine in general. And so regenerative medicine probably came about maybe the first came out about 20 years ago. Arnold Kaplan is at the Case Western Reserve. He's kind of the guy who coined that phrase, where it was going away from symptom modifying medications to disease modifying biologics. So we're using peptides, which are basically molecules found in the body. We're using growth factors, and we're using cells, typically from the patient back into the patient to patient heal themselves, like patient heal thyself. This is a prime example of it. One of the goals, this works in both vet med and human medicine, is, so let's say, example, somebody's sore and they take Tylenol or they take ibuprofen. Those are simply symptom modifying. They do nothing for the underlying process. Regenerative therapy, so the one kit that we make is called platelet-rich plasma, PRP. It's been shown in joints to be disease modifying both synovium and cartilage. So now what that means is you can have better effect and longer lasting effect treating with something that came from your body.
Your website, you talk about rebounding and therapeutic outcomes.
Mm-hmm. Yeah, so that's actually the brand name of our kit is called Rebound. And so we're looking for the FDA considered, like, they keep track of adverse events, not only for drugs, but also for medical devices. And they actually consider lack of efficacy a side effect. And so that's what
the FDA.
The FDA.
So they're even involved with veterinary medicine.
Yes. It's a little different on the human side and the vet side, but the FDA absolutely has oversight over both. Sometimes on vet med, you'll get the USDA, the Department of Agriculture, involved. There's a little bit of overlap, but regardless, there's government involvement.
But there's a whole protocol just like there is for the FDA, just like
Absolutely.
like we've come to learn about our medicines and things of that sort. So, regenerative medicine. I mean, what is the future of something like this? This sounds like it has great innovation.
Yeah. So I would say right now in regenerative medicine, let's use a baseball analogy, I think we're hitting a lot of singles and maybe some doubles. The goal is obviously to hit home runs. What to me I think home runs are going to be is when we get into gene therapy. So we can, and that's for more specific conditions, specifically when somebody has a genetic defect. So then we can hopefully treat them sometimes in the utero before they're even born. Otherwise, we can treat them early so they never develop that disease. The other goal is more where we talk about organogenesis, so making organs. And it's really complex. So we can actually grow organs. The problem is how do you grow an organ and then incorporate it into your body without your body rejecting it? And so that's what the future right now is working on is, okay, how can we take these structures, grow them, and then put them in the body where the body will actually accept them? I think that's still, I would say if we're lucky, 10 years away.
And when this unfolds and it comes about, what would the impact be on agricultural animals there, and even domesticated animals?
Yeah, so for farm...
Who typically live, what, 5, 10, 20 years maybe?
My dog is 17 and a half, okay. But she's a big dog, so she's the exception to the rule. Horses can live into their 30s. Cats and dogs can get into their 20s. Cattle, so when you get into food animal is a different business, meaning it is a business. And this is where some of our therapies in food animal don't make sense financially. It's not that they don't make sense from a medicine point of view, it's just not cost effective. When people raise cattle or sheep for the show ring, that's a different story because then they have pet, they have a name. When they're part of a business model, so dairy cows, you rarely, if you go to a high-functioning dairy barn, it's rare to find cows that are going to be 10 years old because at that point their production is waning off. It's cheaper to cull them and replace them with the younger one. Similarly, some of these regenerative therapies, they will be used absolutely in cats, dogs, horses, where they're more pets, they're part of the family. Food animal, it's going to be tougher. We can still use things like PRP, PRF, plasma platelet fibrin, to help for acute injuries, but these are treatments that may cost a few $100s. And even that, in some animals, if it's your typical dairy cow, they're going to make a decision, does this make financial sense? You get some of the top breeding bulls that could be worth tens of thousands of dollars. If they have an injury that you might be able to fix for a $500 treatment, they'll do that all day long. But those are the exception to the rule in agriculture.
So we're pointing towards a better quality of health, the outlook in the next decade.
Yeah, and we're also trying to get away from antibiotics because if we use antibiotics in animals, those antibiotics end up in us. And so this is why there's kind of a shift trying to go towards organic. And that's one of the things with these biologics is they're not I shouldn't say it. So PRP can be actually antimicrobial. So platelet-rich plasma can actually fight infections, but it's not considered an antibiotic. You can't develop resistance to PRP. Whereas if you give antibiotics to a cow and then low doses get into people through eating the meat or the milk, we can, all of a sudden, those low doses of antibiotics aren't enough to kill bacteria, but the bacteria can learn them and basically acquire resistance to them. And that's why there's a big shift to trying to get away in veterinary medicine to help human health.
Oh. And on, again, your website, there was a presentation about platelet-rich plasma,
yep.
which is one of the items that Enso makes. So how is this used? I mean, again, I don't think many people give it a thought. If a dog or cat needs blood, or I guess, again, an agricultural animal, it's much bigger. This must be a huge area.
Yeah, so PRP stands for platelet-rich plasma, and what we do is we take blood from a patient and spin it down in a centrifuge.
A patient?
Yep, a patient. Cat, cow, horse, human. Doesn't matter.
Those patients.
Yeah,
okay.
yeah. Somebody who's somebody or some animal.
Not a human patient.
No, it can be human as well.
Really?
So, yeah, if you go to Johns Hopkins website right now, Stanford's website,
right.
Hospital for Special Surgery, the #1 orthopedic hospital probably in the world. Their websites, they're treating people with PRP. So what they'll do is the patient comes in with a malady. It could be a cow, dog, cat, horse, human. The doctor in charge, whether that's an MD or DVM, will assess the patient, and if they determine PRP might help them, it's a procedure that takes less than an hour. So it's a blood draw, and then we centrifuge it, typically 10 to 20 minutes, to separate the red cells from the plasma. And we spin it in such a way, and it's also species specific. You think all blood separates the same. Horse blood separates really easy. Cow blood is really hard to separate. Humans kind of in between the two of them. So what we're going to do is we're going to concentrate platelets in plasma, and then the doctor, in the case, is going to inject that portion of plasma back into that patient. So there's nothing to be rejected by the patient. In equine medicine, there's actually 2 published studies as to how common PRP usage is. One study, they surveyed vets that do sport horse medicine, and 86.5% of them use PRP. Another study came out about 3 years later, looking just at boarded equine surgeons, and found almost an identical number, 87.5% of them use PRP. On the human side, it's not nearly that evolved. Like if you went to your GP and said you do PRP, they probably wouldn't even heard about it. But I said you go to these major orthopedic centers, Stanford, Johns Hopkins, so forth, they're treating people with PRP. Why? Because the data shows not only does it work better than steroids, it works longer than steroids, and unlike steroids, which can have side effects such as avascular necrosis of the femoral head, or predispose you to infection because they reduce the immune system's response, PRP doesn't have any of those side effects with it. The problem in medicine is it's slow to implement change. The person I mentioned earlier, Arnold Kaplan from Case Western, he's like, it takes about 20 years for an idea in medicine that's actually good to become fully accepted in mainstream. And he was pretty much spot on. The first publication with PRP was at the University of Miami in 1998, which is 25 years ago. And it's taken about 20 years before now, like I said, the major medical centers are actively using it.
Mm-hmm. And I read about joint injections, which I guess, again, for many animals is a major issue, right?
Yeah, so if we have arthritis, most common thing, osteoarthritis in a joint.
I guess like humans, many animals are in pain, right?
Absolutely. And you can treat them systemically, so this is like taking a Tylenol pill. And we have oral drugs that we can give to cats, dogs, cows, horses. We also have injectables that you can just put into the muscle for the same idea or into the vein. But if you can inject into the joint, you can put a much stronger dose into that joint without having to waste it in the rest of the body. And the data shows that they typically work better. So in the equine world where these are athletes, like these are the Ferraris, they get joint injections all the time. So if you're an equine only vet, you're injecting joints almost every day of the week. The small animal world, it's just starting to get there. Like again, if you went to the big referral centers, so if you're up in Burlington or Albany, Boston, the big referral centers, they're injecting joints every day. You go to the small GP practice, and it depends. The ones that are more on the cutting edge will be doing joint injections. It's not typically part of their normal routine, though, and so there's a little bit of hesitation. And that's one of the reasons why we've recognized that that's a barrier to entry. So we actually train veterinarians, typically companion animal veterinarians, how to do joint injections in cats and dogs. Similarly, on the human side, we actually treat physicians how to do joint injections because unless they've done an internship or a fellowship or residency where they do joint injections, you typically don't, in medical school, they don't cover that. And so we actually help physicians do this as well.
And you seem to have a line of centrifuges, which is a big thing.
Yeah,
right?
so first of all, I didn't invent PRP. PRP has been around for, like I said, 25 years. We designed a kit to make PRP that was just, we looked at the systems on the market, and there's 20 PRP systems on the market. And one day, I just had an epiphany that they were overly complicated. It really shouldn't be that hard. And so I sat down with a friend from K-State, Dr. Charan Ganta. He's actually now at the NIH, but he's a regenerative medicine specialist. We sat down at the dry rate board and said, let's make our own kit. And the first thing we decided when we make the kit is, let's make it fit into the standard centrifuge. So the other kits in the market is though, it's like the engineers designed a tube and said, okay, go find a centrifuge to fit it. So the centrifuge was an afterthought. And it ends up being this big, costs $5,000, and it weighs 50 pounds. I looked at backward and said, if a clinic has a centrifuge, whether it's a veterinary clinic or a human clinic, it's for spinning blood. And so we made our PRP tube to fit in the same centrifuge that spins blood. So it's a centrifuge that's this big and only weighs $500. So we don't make the centrifuges. We just have a contract with a company. So we just put our label on the centrifuge.
We're coming to the end of our show. Lab services and histology, which is on your website.
Yeah, so we've actually transitioned out of histology. In the veterinary space, kind of like on the human side, if you've ever had to go in for blood, a lot of times your doctors say go to Quest Diagnostics and they'll draw your blood and do it. The veterinary side is kind of the same way. Either the small animal clinics will do a lot in-house, and when they outsource it, they already have a contract with these other companies. So we end up selling some of our histo business to one of these larger companies.
And I guess with all of this, Dr. Orava, there is a rubric of continuing education that veterinary doctors must follow, a regimen, right?
Correct. Yeah, and each state has their own kind of guidance as for what's approved CE, meaning continuing education. And there's a national organization they call it RACE. Registered, I'm not sure, continuing education. But if you're RACE approved, you're approved in every state and every province in Canada. And so we have RACE approved CE for either 1 hour or 2 hour units, depending on what we're training. So what that means is we can show to veterinarians that our CE is science-based, it's not marketing hyperbole.
And veterinarians, I guess, similar to MDs, where there are specialty designations and specialty peer review societies. I guess that exists in
absolutely. You're not gonna have as many specialties as on the human side. Like my mom has problems with her eyes, so she has, I think, 4 ophthalmologists. One for her corneas, one for her glaucoma, one for her lens, and just the regular ophthalmologist. On the veterinary side, you can be board certified in ophthalmology, but it's typically you're an ophthalmologist. It's not like, oh, I only do glaucoma.
Dr. Corey Orava, we're out of time.
No worries.
I want to thank Dr. Corey Orava, Chief Scientific Officer of Enso Discoveries in Kansas. And thank you very much for being a guest on this edition of Danny Frank.
Thanks. Good to be here.